what is still perhaps the best protection against colon cancer? It would definitely be an endoscopic evaluation, or at least some type of screening tool to investigate the colon. So when I see a patient and we're discussing their needs, they're busy, they're overworked, they're overtaxed, they have absolutely time for nothing in their schedule. Basically what I say to them is this: what fits into your busy schedule better? A colonoscopy every 10 years or being dead 24 hours a day? I think it's a pretty easily answered question. And I think anyone who thought about this and really the small incremental, sort of time it takes to be able to prepare for an examination over the long run probably makes a major difference in one's health. So where does this evidence about a colonoscopy, where really does this come from? Well, the grand poobah of studies was the National Polyp Study, also known as the NPH. And this was a study that was done in 1993 by Sid Winnower. And this involved the incidence of colorectal cancer following a coloscopic polypectomy. And basically what they looked at was over a 7-year follow-up of time. They compared those patients who had in green, had a colonoscopy with a polyp taken out. They compared it to other historical controls of patients who did not have a polyp taken out over that time period. And that was in the SEER database, in St. Mark's Hospital, and in Mayo Clinic. And they were able to see in this patient population that merely by doing a colonoscopy and taking out a polyp, they decreased the risk of colon cancer between 75 to 90% in that patient population. So what are we trying to find when we're doing a colonoscopy? We're really not trying to find colon cancer. We're really trying to find the polyp, which we can do a polypectomy on and almost take away one's risk of developing colon cancer from that polyp. So in the National Polyp Study, there were over 14,000 patients who were identified with an adenomatous polyp at colonoscopy. These patients underwent periodic colonoscopy for an average of 5.9 years. And there were 5 asymptomatic early stage colon cancers detected by colonoscopy after that baseline colonoscopy with polypectomy. 3 of these patients had their polyps or their malignant polyps or cancers identified at 3 years' time. 1 was at 6 years and 1 was at 7 years. Now, the expected number of colorectal cancers to be identified based upon historical controls would have been about 20.7 to 48.3 patients. However, because of the polypectomy, what was seen in this study was a reduction in colorectal cancer incidence between 76 to 90%. This reduction was a major innovative breakthrough in our understanding of the natural history of colorectal cancer and our understanding of the role of polypectomy in decreasing the natural history of colorectal cancer development.